We can see that Vyadhi Mula Sthana and the Dushyas involved. We can see that the Prishta Vamsha is consisting of, it's a very, very, very complicated structure, as we know. There are joints in between, that is, the asthis are there, the Kashairuga asthis are there. Somewhere they are joined together. We know that there are 7 cervical, 12 dorsal, and 5 lumbar vertebrae, and the sacral vertebrae are joined together, and the coccyx are joined together. So you see that asthi or Kashairu is there, Taruna asthi in between that. The Kashairu is the disc material, which is of Tarunasthi material. Sandhis are there, Achala Sandhis and Chala Sandhis, partially Chala Sandhis. Now, the most mobile part of the vertebral column is the cervical vertebra. The dorsal vertebra are moderately, very, very less thing only. And the Prashtavamsha at the lumbar level is for Dharana. It is the mobility is between that portion and the cervical, the sacral region. So we have the trigas, which are very important as far as Marma Chikitsa is concerned, the upper triga and the lower triga. We have the mamsa or peshis, which are adjacent to the paraspinal muscles. We call all the muscles which are coming, even the intracostal muscles are starting from there. There are the kandaras which join to the peshis together. There are the snayus or the ligaments or the bands of very, very thick bands, like we have the band-like structures posterior and anterior to the vertebral column. And then we have the Griva, Prishta, Kadi, Triga, Shroni, Pradesha, whole. We will have to consider the adjacent places. So I'm not going into the modern part of it too much, because we have to view everything from the Ayurvedic point of view. So now Srotas involved are, we can see that a Kati Shula, a Griva Shula, or Prashtavamsha Shula, Prashtavamsha Ruja, Graha, etc. can occur due to right at the Mamsavaha Srota Dushti itself. Mamsavaha Srota, Mamsagata, etc. We can see that it may be a lumbag only. But when it can go into the Medhovaha Srotas, involve the Gambhira Dhadus like Astivaha Srotas and Majjavaha Srotas. So we can see that right from the Bahya Dhatu, like the Mamsavaha Srotas or the Mamsa, Peshi, Kandara, it can go into Snayus, it can be due to some problem or some affection of the Nidova Srotas, the Astiva Srotas, when directly the Asti is involved, either due to the Astidhadu Chaya, especially which is happening now. We get patients with all osteopenia, osteoporosis, and even sometimes Majjava Srotas when TB spine is there, or any thing which involves the myelin sheath. So many conditions we can see that these are the Srotas which are primarily involved. And this does not mean that the other Srotas are not involved, because right from Rasava Srotas, you know that we can have, and Annava Srotas, we can sometimes, it may be due to a Koshtagata Vata only, you have a Kati Ruja. So those also are involved. But when we consider it from the modern orthopedic point of view, we can take these into consideration. And the dosha involved usually is Vata and Kapha. Flexibility and stability are the opposite attributes which coexist in the backbone. This is a wonderful phenomenon which we have to accept. There are portions which give the dharanatam, the portions which give a mobility. So flexibility and stability are opposite attributes which coexist in the backbone. Flexibility is contributed by the tender dhatus, like the muscles and the tendons and the soft ligaments. But the stability is given by the hard ligaments and the bones and the cartilaginous tissues, etc., which are there. The flexibility is given by the Sleshaka Kapha, which is there in between the sandhis, and you can see that facilitates the movement, and any involvement of that sandhis or Vata, increase of Vata and decrease of Kapha there will make it a painful, immobile situation. So this is responsible for the normal function and also the abnormal presentation. Restoration of this is aimed in planning and execution of the treatment of an IVDP case. So what now, when we look from the treatment point of view, the Sreevaths involved has to be, the damage which has been done has to be calculated. And what we are doing ultimately, we are correcting the flexibility and stability of the spine totally. So restoration of this flexibility and stability is aimed in planning and execution of the treatment of an IVDP case. Now,